Well, welcome back. Thank you so much for joining Caring Ambassadors Program video series, Learn from the Experts. This is part 3 in our series, Nutrition in the Patient with Lung Cancer. I'm Lauren Sant, the Executive Director at Caring Ambassadors Program, and I'm joined today by Cindy Langhorne-Hatfield, our Lung Cancer Program Director, and a panel of people living with lung cancer and their caregivers. We're excited to welcome back Rhone Levin, a Clinical Oncology Dietitian at the Florida Cancer Specialist and Research Institute in Fort Myers, Florida, as our featured author in this video. Rhone will be discussing questions and concerns from our panel of people living with lung cancer. We hope this video will provide helpful insights and information for patients and caregivers living with lung cancer. If you're interested in learning more about Caring Ambassadors Program and our mission to help patients with lung cancer, please watch this video series and please share this information with anyone who might find it useful. Together, we can make a difference in the lives of those affected by lung cancer. Welcome, everyone.
Me here. I appreciate Caring Ambassadors giving me this opportunity to talk to you about nutrition. My name is Rhone Levin, and I'm a registered dietitian nutritionist. I'm board certified in oncology nutrition, and I'm here today to discuss questions from our panel of patients and caregivers.
Rhone, with the recent news about water and contaminants, should people diagnosed with cancer cook with filtered water?
So I think it depends on where the person is living. So there is definitely a question about well water and making sure that people have tested their well water. The biggest issue in terms of lung cancer risk, I mean, there are other risks as well, but is the arsenic. And so if you're on a city water system, you can actually access on the internet, you can access your public records, city contaminants. Of course, every professional water source is going to work on reducing any of the risks, but you can actually see where it falls and how it compares with the EPA appropriate levels. If you were in a situation where your water was questionable, I think using filtered water would make sense. There are good systems that can filter your water before it gets to your faucet. So that would be worthwhile to look into and to talk with a plumbing expert as far as installing like a reverse osmosis type system or something like that.
Thank you.
Turning to diet, Lynn, I think you had a question on living longer.
Right. So thank you. My question is actually a good one because most of us are living longer now, but a lot of people are diagnosed early, even under 40. So are there different nutritional needs for those of us who have been over 65 when we are diagnosed as to those who are much younger?
That's an excellent question. And the answer to that is found in the resources through the American Institute for Cancer Research. That's an organization that has done the bulk of the worldwide data collection and evidence. Their original mission was to discuss or to help people to learn how to prevent cancers. And in fact, as time went along, they found that there was a large component that actually led right into cancer survivorship. So in other words, the same sort of diet that you would follow for cancer prevention is the same sort of diet that's recommended for you in terms of cancer survivorship. And in fact, people who are following the cancer survivorship guidelines actually have a reduced risk of recurrence for many types of cancer, as well as healthier overall life. Kind of a backstory to this question is also, when we talk about a cancer preventative diet, in years past, we used to say, oh, you eat this way to prevent heart disease and that way to prevent diabetes and this way to prevent cancer. Well, it turns out it's all the same diet. So the cancer preventative diet, in fact, is good to prevent all kinds of illnesses. So whether you were diagnosed and treated at a younger age or an older age, it's the cancer preventative diet, which is available at AICR.org, American Institute for Cancer Research. Those guidelines would be the best answer for everyone.
Thank you.
Sherry, I know you had a question on diet.
I take a TKI, and I was just wondering if I should consume more protein due to it breaking down my muscles constantly. I know that taking too much protein could probably damage the kidneys, but I also have the problem with my muscles constantly breaking down.
I think that's a great question. So anytime you are in the healing process or under the effects of a medication that is, for example, breaking down muscle tissue, it is appropriate to consume more protein. A dietitian will do a calculation, which is about 1.2 grams per kilogram of your weight, to kind of give you an estimate of how much protein you should be eating. But basically, what I recommend is protein at each meal. So 3 times a day, consuming some kind of a protein food. If you are consuming any snack, that's another opportunity to include protein in the snack. If you feel that your protein intake is not consistent, then using a protein supplement is a good idea. And so everything from a protein bar to a protein drink, and of course homemade, are totally fine, I think is a smart idea.
Thank you.
Tiffany, I know you had a question about vitamin supplements.
Thank you. Rhone, when we're not eating as much as far as our intake, what do you think about taking extra supplements for that supplementation so we are still getting our proper nutrients?
I think that's a great question. The answer to that kind of depends on what part of treatment you're in. A nutritional supplement that is a multi-supplement, like a multivitamin or mineral supplement, that reaches a level of 100% of the daily value. When you look on the label, it will always tell you the percentage. Something that is in the mid-range of about 100% RDI is one way to describe it, would be acceptable for most treatments. Sometimes certain treatments, they may suggest pausing or holding additional supplementation. An example of this would be single source nutrients, for example, high-level antioxidant supplements like a vitamin C supplement. They may suggest pausing during radiation treatment because there's a potential that it could interfere with the radiation treatment. So my recommendation would be try to work with your diet to consume a balanced diet. If that is not possible, then to discuss with your medical team the option of using like a standard multivitamin, with the understanding that there might be certain time periods where the doctor may ask you to pause.
Thank you.
Carla, I think you had some questions on antioxidants.
Yep. Hi, thank you. I've read that antioxidants are supposed to help because they decrease inflammation, which is a possible cause of cancer. And in the reading, it had mentioned something about taking high dose antioxidants during some treatment, but then to avoid high dose antioxidants. So which is it, and what's a good dose of antioxidants?
Excellent. Yes, this is a kind of confusing area. Actually, we're kind of changing our understanding. It's not so much antioxidants, but it's more phytonutrients. Phyto meaning plant, P-H-Y-T-O. Phytonutrients that are the values. Some of those phytonutrients that have anti-cancer activity are also antioxidants or work as an antioxidant. So long story short, the food level of antioxidants and phytonutrients is very beneficial for cancer prevention as well as reducing inflammation. So the food level of including, for example, let's just use blueberries, source of antioxidants, is a great idea at any point, either in cancer prevention, cancer survivorship, or cancer treatment. The recommendation against using high-level antioxidants is during specific kinds of treatment. And so, and just as an example, radiation treatment is an oxidizing treatment. There's a concern that using high-level single-source vitamin supplements, and I use the example of vitamin C because many people take or consume vitamin C supplements. So at that point, there's a question mark is, would it be reducing the effectiveness of the radiation treatment? And we have seen that in certain cancer types. So that's why the doctor may ask you to pause like individual nutritional supplements, especially if they have antioxidant activity. Maybe nutritional supplements that your doctor has recommended that are perfectly fine to use during treatment. So it's important to discuss this with your medical team. An example of a supplement you might be using throughout your treatment is vitamin D supplement, if that's been recommended, perhaps a calcium supplement. So it's important to talk with your medical team about what's going to work best for you.
Thank you.
Sherry, I think you also had some questions about supplements.
Or I wanted to know about selenium. I had read that a lot of people that are deficient in it feel better taking it, but then I had read that it actually can make lung cancer progress. So it's kind of confusing. Should we be tested? Should we be followed for our selenium levels regularly to see, are we deficient or not deficient? You know, because I had read, you know, the side effects are fatigue, muscle weakness, brain fog.
That's a great question. kind of in a general context, anytime you're thinking about taking a mineral, so selenium is an example of a mineral, but also iron is a mineral, it is important to discuss with the medical team because you can actually collect too much of a mineral. Your body may not have a good way of getting rid of a mineral. And so, in fact, it's not a great idea to use a supplement unless you are deficient. So in that situation, especially regarding selenium, I would talk with your medical team if you thought there was a concern. It is rare to have a selenium deficiency, but it can happen. Before you would consider using a supplement, it would be important to talk with your doctor and to have that tested. The same thing with iron, same thing with zinc. I find a lot of times people will be taking zinc kind of randomly, and in fact, it's not a great idea to use zinc over a long period of time as a single source supplement.
Thank you.
Rhone, I wanted to know how you feel about the dehydrated vegetables and fruit supplements that they have out there, like Balance of Nature.
There are a lot of different options available to get our fruits and vegetables in. Certainly, the original kind of best option would be to consume fruits and vegetables in whatever forms you feel most comfortable. And that might mean fresh fruits and vegetables. According to the American Institute for Cancer Research, they say fruits and vegetables, eat them, including even canned fruits and vegetables have tremendous value. So our understanding of these nutrients is changing over time, kind of in what value we can get out of them. If there is a time period where you don't feel that you are consuming an adequate amount of fruits and vegetables, there are options which include, for example, like a nutrient supplement. The powdered form of these fruits and vegetables, I think, is a nice idea. I don't have any data necessarily of what's exactly in those particular products. And I've actually contacted these companies to see if I can get a rundown of what they're actually providing. My recommendation, if you want to use a product like that, is it's probably safe to use, but I wouldn't necessarily have you use it every day. So you would use it kind of in a way to enhance your diet, just like you would with different fruits and vegetables, versus taking it at kind of like a sustained or high level, especially if you're in treatment. Just because I'm not sure, what or the percentage of the RDI, for example, is it providing for different nutrients. So I'd use it in like an occasional supplement, maybe a couple times a week versus using it on a daily basis.
Thank you.
I understand the philosophy that when you're in treatment, all calories are good calories. But what if this leads to a lack of protein or it increases your potassium and you have a kidney issue? Is any calorie a good calorie?
Well, that's a great question, which I think is very individualized in terms of a person's background, their medical situation. And in that setting, for example, in somebody who's had a kidney injury or has to be careful with potassium, we would definitely be selecting those foods that do not add extra potassium. And in that situation, I would share with a patient an example, a list of foods that have high, medium, and low potassium content so that people would have that kind of background of, okay, out of this list of low potassium foods, these are the things that I feel like eating. I would also evaluate for a person their level of potassium that is registering in their blood. In other words, do they have to avoid all potassium foods or can they have one high potassium food a day? So that type of evaluation would be very helpful for that person. Regarding the question about protein, protein is going to be important regardless of what other dietary restrictions you might have. And so we would look for protein foods that are tolerable for that person. And just for example, some people may be vegetarian or some people may have food allergies, things like that. So we would select from the proteins that are tolerable for them. And then if it's in a situation, again, where somebody has like a kidney injury where they have a restricted protein intake, we would make sure that between the food that they're eating as well as any supplements that they're using, like nutritional supplements, that we would be at an appropriate level of protein for that person.
Thank you. So a lot of our discussion has been focusing on our nutritional needs during chemo, after surgery, or radiation. But a lot of us are now on immunotherapy or targeted drugs. We're just fine, but we may have repeat episodes and recurrences. So are there any nutritional concerns we should take about other than that preventative diet that you just talked about?
So I think that's an excellent discussion in terms of what are the best ways to move forward. And even on an immunotherapy, your nutritional needs are still going to be slightly elevated above and beyond what you would normally eat. The body is still functioning in a way that is kind of continuing that healing process. It's a lot lower level than the active treatment, but it's still present. So we do want to make sure that you are focused on adequacy in terms of calorie and protein during that time period. We would overlay that if you have weight goals, for example, sometimes people have lost weight during treatment or trying to regain weight. Sometimes people are going through physical therapy, trying to regain muscle. And sometimes people are doing just fine. And in that situation, we are really emphasizing survivorship nutrition recommendations. Again, I would refer people to look at the AICR.org, which is American Institute for Cancer Research. Look at the survivorship recommendations. It's a lot about building up the exposure to those nutrients which reduce your risk for cancer. And they have demonstrated in the evidence that people following a prevention type lifestyle, which there a portion of that is food. There's other recommendations in there as well, including physical activity, including management or healthy weight. Following those guidelines does reduce the risk for recurrence, as well as reducing the risk for a secondary primary. There is no good reason not to eat healthy. I guess is the answer to that one.
Thank you.
Are there any foods that they're looking at that directly cause cancer or conversely could cure cancer? Are there any studies in that direction, just specific ones?
That's a very interesting topic. There is research in particular regarding those kinds of foods, and I think we've already talked about that, may increase the risk of many different kinds of cancers. The guidelines for prevention of lung cancer, the suggestive evidence says that red meats and cured meats or processed meats may be linked with encouraging the development of lung cancer over the lifetime. So are there foods that we should probably be eating less of? It doesn't mean we necessarily have to completely avoid them, but we should probably be eating them less often. I always recommend that people look to other established health diets, including like a heart healthy diet that kind of limits red meat at about twice a week as part of, your day-to-day intake. So I think that's a smart thing to do, that we can parallel our cancer preventative diet along the same lines in terms of reducing risk for developing cancer as well as lung cancer. This is also true, by the way, the same guidelines as far as preventing GI tract cancers as well, so gastric and colorectal cancers. Regarding foods that may be curative, I don't think that we really have any evidence that food or diet in and of itself can cure cancer once it is developed. Although nutrition can help in the prevention, and it can help in terms of supporting the process of healing while you're undergoing the evidence-based cancer treatments, there isn't anything that we can point to that would really be like an answer that we could use in place of other treatment. Thinking down the road in terms of strategies, there is research that's going on in different kinds of cancer types, different timing of eating. This isn't necessarily while you're in treatment, but more like in the preventative lifestyle. There's also these anti-cancer nutrients. What would happen if we food more of the anti-cancer nutrients in our diet? You can look for that information on the AICR.org website. They actually have a whole section called Foods That Prevent Cancer. And of course, this turns into the wide variety of fruits and vegetables that are a wealth of these plant nutrients that have anti-cancer activity. That's probably the best advice that we have.
Well, hopefully preventative things will turn into curative things down the road as they study more things. And it'd be great to find an easier cure to,
absolutely,
not just, but prevent it with a more hard line than just these generalities of eat better and exercise more and stuff. It'd be nice if they found something hard and fast. Wishful thinking.
Well, if there is anything, the first people who would recommend it would be your doctors.